Hi, I'm very happy to introduce a very special patient to you, very special to me, because it's my older brother, Khalil Kermani. Khalil is a medical doctor in orthopedics, and well, I did the cataract surgery on Khalil in January this year. And basically what we did was a femtosecond laser assisted phaco emulsification of both eyes, and then we implanted a non-diffractive EDOF intraocular lens. And the special thing about this maybe was that we performed a blended monovision, a micro monovision for him. And I'm very happy that you're willing to answer us a few questions. Thank you that you're here.
Thank you that you did this operation for me.
Well, I feel very privileged that I was allowed to do it on my older brother, actually. So how long did it take that you could come back to your normal way of life? How many days or weeks?
I could see quite normally the second day. And because I was told to be a little careful, I tried not to read too much or not to do things like heavy sports. But after 1 week, I forgot all these things and I lived quite normally.
Do you remember any kind of discomfort with regard to night vision complaints? Do you see any halos, or are you?
I had these halos the first maybe 2 weeks or 3 weeks.
Okay.
They disappeared afterwards. I didn't come back again.
Okay. And do you feel that you have a very good visual acuity compared to when you were a younger person in distance vision and near vision? Or is there anything where you would say, no, it's not that good?
No, it's a problem for the rest of my fellowships, because they are very jealous that I'm looking so good and seeing everything. And now they have to prepare the face before they come.
Okay.
For me, it's fantastic. I see everything.
Okay. I would like to make a test in order to prove what you're saying. I mean, I know that you would never fool me, but in order to prove this really, I would like to have you read this. So this is a reading chart, and let me know how far you get down with the letters getting smaller and smaller.
I'm just looking on the lowest one, and
you can read it in German.
I read it in German. Wenn durch ein Fenster schaut, könnte einen Vogel sehen.
Well, this is impressive. This is J1 plus. I think this is quite impressive for somebody who has a EDOF lens, and his distance refraction on the near eye is -1 for distance, but yet he can read J1 plus. With the EDOF lens, non-diffractive. Very impressive. Thank you. The intraocular lens that was implanted in this case is a so-called EDOF intraocular lens, extended depth of focus. The Acunex Vario is a hydrophobic and blue light filtering foldable intraocular lens that consists of 2 optical areas, of which one is directed for the distance vision and the second one is directed for intermediate vision. The pseudo-accommodative power of this intraocular lens is +1.5 diopter, which enables the patient to comfortably see both distance and intermediate vision. Good morning, Tobias Neuhan. Thank you very much that you share your precious time with us. Tobias, you are one of the most experienced and best regarded eye surgeons in Germany. You've been in surgical practice, I guess, for 30 to 40 years or something like that. You have seen a lot of products coming and going. What is your general opinion about EDOF intraocular lenses and especially the Acunex Vario?
I think the evolution which we have with the new EDOF lenses is great, because the distance vision works like a normal monofocal lens, but you have an add-on that patients can also see in the near and in the intermediate part much clearer than if you have just a regular monofocal lens. This is a beauty of the new optics which we have available now.
Thank you. I know that you have systematically checked the results that you achieved with the Acunex. You have a little study ongoing, which you presented lately. Can you comment your experience or your data?
The product is quite new. Therefore, we were interested. Does it work as good as the previous lenses, or perhaps better, or what else? We see that in the column, which is the light blue, that 100% of the patients after 6 months see that is 20/25 without correction in the distance, which is amazing. But and it's only one eye. When you use and bring the second eye together, then they have even better distance vision. A quarter of the patients even see better than 20/20. They have 20/15 vision for distance with one eye. The next column, which we have seen in the left side, we see that the intermediate vision performs also quite good with this lens. 100% of the patients have 0.6 vision for intermediate. And then the right table, you can see that more than 90% can read newspaper without glasses, with one eye. When you take the second eye together and have a good light, then you can just read your regular newspaper, like the Sun or whatever you want, or the New York Times, without glasses.
Sometimes with the diffractive multifocal IOLs, we have patients who complain about night vision problems. They see halos, they have distinct loss of contrast visual acuity. Is this something that you get described by the patient with this product as well?
With the EDOF lens, this is not true. The EDOF lens has no photopsias, no halos and glare. And especially for all older patients, most of them have the cataract, they can drive car at night without all these side effects, which for them are more difficult to oversee than for younger patients.
Thank you, Tobias. This is very impressive, and we are looking forward to see more developments and more results. I'd like to thank you very much. I send you cordial regards from Cologne. Stay safe, stay healthy, and I hope to see you soon in person again.